morning, everyone. Thank you for attending today's session. This is our virtual spotlight during our UPHS open enrollment period. And today's session is an exciting one. It is with our new behavioral health provider, Lyra. And we have James Maloney here today from Lyra. And he's going to walk us through our new benefit and what we'll have available starting July 1st. And I should have said hello myself. My name's Erica Lopez. I'm the corporate benefits manager for the health system. So I'm happy to be here to introduce James and to have everyone learn more about this new benefit. The chat should be available to everybody. So if you have questions, send them through the chat. We're going to have James go through the slides first so we can make sure we cover all the material. And then we'll make sure we save time at the end so we can answer questions. So just put them through the chat and we'll make sure to get to the questions. And I just want everyone to remember, though, it is a recorded session. So just be careful. I'd recommend not sharing like personal information through the chat or, during the session. We can always handle personal things offline. Right. So, James, if you're ready, I will turn it over to you.
Excellent. That sounds great. Good afternoon, everyone. My name is James Maloney, and I am a Director of Customer Success at Lyra Carillon. I'm honored to be able to work with Penn Medicine going forward. As a Philadelphian born and bred, I live out in Bryn Mawr now. But it's really exciting to be able to support a community of healthcare workers that I count my doctor as a part of as well. So I'm really thrilled to be able to support your team. So today we have a full agenda to walk through here, and I'm excited not only to go through the questions, not only to go through our agenda, but then also answer questions at the end. So the intent here is I'm going to spend somewhere between 10 and 15 minutes giving your team an overview of what is changing in your behavioral health benefit, and then talking a little bit about Lyra Carillon to give a high-level overview, and then we'll be happy to address your questions at the end. So please keep them coming in the chat. I'm looking forward to addressing them. So here's our agenda today. I first want to start up top just with what is and is not changing about your mental health care benefit. I want to talk through a couple important dates to know as we go into open enrollment and then with the launch of the benefit on July 1st. I know a really important topic for folks, especially through a change like this, is what happens if I'm already in treatment with someone. So I want to talk a little bit about what that process will look like so that you can continue care with your provider. And then I will go into talk a little bit about Lyra Carillon and what you can expect from us in terms of seeking mental health care support across kind of the full spectrum of needs. And then, as I promised, going to devote a good amount of time to questions and answers at the end. I should note, I was just meeting with Erica before this, and we were talking about how this will not be our last session on this topic. We will be scheduling some additional ones and also posting additional information about the benefit to make sure that everybody feels really comfortable going into the new year. Excellent. So let's dive in. So I first want to start with what is changing and what is not changing. So Lyra, the biggest change that is occurring is that Lyra and Carillon are going to replace Quest Behavioral Health as your behavioral health care provider moving forward. The thing that is not changing is anything regarding your benefits design. So when it comes to the costs that you currently pay for care, whether that is in outpatient treatment or inpatient treatment, those costs are going to remain the same. You will be able to enjoy expanded access to a tier 1 network of providers, which will be exciting in terms of lowering cost share for certain providers. And then one of the more important things as well is access to the Penn Medicine EAP is not changing for those who already have been able to access this benefit, and it will be expanding to cover all Penn Medicine facilities starting July 1st. And a reminder that through the Penn Medicine EAP administered by Penn Medicine, you and your family members or dependents are entitled to up to 8 free therapy sessions per issue per year. And that is an important benefit that is not going away, that will also be highlighted throughout the Lyra Carillon experience and is available to you. Excellent. So now a couple important dates to know. So this coming Monday, April 27th, is the launch of open enrollment. And it is also when our phone number, the Lyra Carillon phone number that you see on the screen here, is going to be live to provide more information and answer any questions for you that you may have about your care starting on July 1st. The website that you see here as well, uphs.lyrahealth.com, will also be live that date. However, in a more limited capacity, there's going to be some of the information that I'm going through here today live on that website. The full experience of being able to log in to leverage self-care tools that we have on the site, to be able to search for a provider, so on and so forth, won't be available until July 1st when the benefit year begins. So starting on July 1st, the benefit launches. So you'll be able to visit the website as I described, and you'll also be able to start to participate in care through Lyra. It's also important to note that, and as I'm going to talk a little bit about on the next slide, you are still able to see your Quest behavioral health provider starting that date as well. There won't be any changes starting on July 1st in that matter. And that brings us to the date of October 29th. So between July 1st and October 29th, which is about a period of 120 days, you'll still be able to work with your Quest behavioral health provider just as you have. And during that period, we're going to be working to bring Quest providers in network. And I'm going to talk a little bit about that on the next slide. So what if I'm currently seeing a provider, or what if I am, or perhaps you're taking part in higher levels of care or treatment, or have a family member who's doing so? So as I mentioned on the previous slide, UPHS has established a 120-day transition period beginning on July 1st. And so all Quest providers during that time period are going to be considered in network, and you'll be able to continue to work with them. We are contacting Lyra Carillon, we are contacting all Quest mental health providers who are treating UPHS members right now to invite them to join our network so that you would be able to continue care even after October 29th with that same provider. It's important to note that if you're seeing a Penn Medicine provider right now, someone who's employed by the health system, those providers are going to transition over to continue to be in network even past that date. So you won't need to make any changes there. And then for higher levels of care or inpatient treatment, your care and coverage is not going to change during the transition time period. We understand that, especially with that high level of care and the importance of it, and how disruption could possibly impact your well-being, we want to make sure that individuals are able to continue their care there as necessary. And then we'll also be able to provide, through our 24/7 care navigation team, step down to support to help you with your care after you leave an inpatient facility or a specialty program or higher levels of care. Perfect. I see lots of questions popping up in the chat, and just want to remind that at the end of the session here, I'm going to tackle some of those. So please keep them coming, and we'll be happy to discuss them. And anything that we can't get to today, we will be able to follow up on as well. All right. So now that I've talked a little bit about what is changing and what is not changing about your benefits, I wanted to introduce you to Lyra Carillon so that you can understand what your benefits are going to look like, and what you'll be able to enjoy through this partnership. So the three key things to know here are that Lyra Care and Carillon are for everyone. We support all ages, from everyone down from infants, usually the parents when it's the infants at that stage, up through teenagers, and have some specialized programs to support them in particular. And then, of course, to be able to support you and all the other adults that are covered under your health plan. Lyra Carillon provides the full spectrum of care. You're going to be able to enjoy everything from self-care, using digital tools on our website. You'll be able to search and find an outpatient provider. We offer medication management services as well, so that you can either explore medication to help your condition, or to be able to continue treatment with a current medication that you're taking, or to explore others if you're not currently happy with what you're taking. And then I'm going to touch a little bit more on the next slide about this, but We also provide the full range of complex care services and navigation, whether that's inpatient or residential treatment, navigating neurodiversity and autism spectrum disorders, all of those benefits that you've been able to enjoy under your current plan design are going to remain throughout this partnership as well. Also want to call out that we want you to participate in care however is best for you. Our large network of providers provide both in-person care and virtual care. You're able to call our 24/7, 365 Lyra Care Navigation team anytime that you would like. We want you to be able to participate in care in the way that's most comfortable for you. And then finally, always important to note that a really strong and effective mental health care is built on the foundation of confidentiality. So everything that you share, just as it is with Quest today, everything that you share with your provider remains between you and your provider. This is private information. We are HIPAA compliant, and the information is not shared back with Penn Medicine. All right, as I mentioned, I did want to do a quick double click here into our support for more complex needs. Rarely is mental health a condition, or are mental health conditions binary in terms of just having kind of one thing going on. Oftentimes there are comorbidities or multiple conditions at once, and a need to be able to treat you as an entire person, and also provide navigation and care for higher levels of care for those individuals who are neurodiverse or on the autism spectrum disorder or experiencing autism spectrum disorder. We want to be able to provide that full spectrum of care that you've already been able to expect through Quest. So our 24/7, 365 care navigation team, I've probably said that 4 or 5 times, and I'm probably going to say it 4 or 5 more times, are available to be able to help you continue and your care today, and also to find care going into the future. It's important to note as well, again, that you are still going to have access to the Penn Medicine providers that you're working with today. Penn has one of the most renowned autism programs in the world, and your access to that is not changing, of course. All right, I want to talk a little bit about the outpatient therapy care that you can expect through Lyra. So we do provide a broad network in the Philadelphia region, the Lancaster, Princeton. We are a national organization, but we generate our network by working with local community providers, just as we're really looking forward to welcoming Quest providers into our network. So you have the depth of a local network to be able to work with somebody in person, but also the breadth of a national network. I was just talking with Erica about the number of people at some of the recent benefits fairs who have come up and said, "Well, my son is under my health plan and he's in Seattle or in Austin." And the good news is that they'll still be able to tap into our network, our national network, to be able to get care there. We we're all about providing care at the level that you're most comfortable. So that is both in-person or virtual care. We also integrate, or some of our providers integrate some digital self-care tools in between sessions to help you with your practices in between sessions. We always say there's about 168 hours typically between episodes, between sessions, if you're having a weekly meeting. And we want to make sure that that time is productive and you're able to work on the skills that you're trying to develop through your therapy practice. We provide a diverse provider network. We recognize how important it is that you are able to see yourself or your lived experience in the person that you're working with. So when you are searching for care for a provider, you'll be able to leverage 15 different preferences, whether they are race or ethnicity, language spoken, religious affiliation. We want you to be able to work with a provider who knows you and sees you, so that you can really focus on your care and not trying to explain who you are. And then finally, as I mentioned, we will also have access to support for medication management if you're already taking medication and need additional support there, or if you're considering medication in the future, being able to work with a clinician through an in-depth evaluation to get you onto a prescription that is best suited for you. Continuing on what you can expect from Lyra Carillon. I love this slide because we have a little GIF going on the side here about just a little bit of what it looks like to search for care through Lyra. This, of course, is showing a phone experience. The experience is very similar on a web desktop. And then, of course, there's no need to leverage digital platforms if you'd rather pick up the phone and call someone. I'll say it again. We have that 24/7, 365 care navigation team who can go through the same process to search for care that you would see on the website over the phone so that you can be provided providers who have guaranteed availability so that you can get into care quickly. So what can you expect from us at a high level? I've already talked about our care navigation team many times, but in UPHS's markets and really nationwide, you can expect to be able to find the first available appointment for an outpatient therapy visit in just one day. That is both factoring in in-person and virtual appointments. On our website, you're also going to be able to access 600 plus articles, activities, meditations in our self-care library, which is constantly growing. So you'll have access to that on our website. Some of the more popular things are some of the meditations that we have or mindfulness sessions that folks tap into in the middle of the day just to have a little breathing exercise. And then, as I mentioned, 100% of the providers that you'll see on the website when you're searching for care have guaranteed availability within the next 2 weeks. We recognize that when searching for care for a provider, it can sometimes take a lot of effort to find someone who is accepting new patients and then to actually get on their schedule. So we try to take the guesswork out of that by allowing you to be able to book online or right over the phone with our providers, as 100% of them have their calendars connected to Lyra to provide that level of visibility and support for patients. All right. One last slide before we start to shift into Q&A. I wanted to remind you all of the important dates here that on Monday, April 27th, open enrollment is going to begin. The phone number and websites that you see here are going to be live. The full experience, so being able to search for providers, accessing those self-care tools will be live on July 1st. And then that transition of care period, continuity of care period, the period in which we're contacting Quest providers to invite them to join the network is going to end on October 29th. Excellent. Why don't we shift into question and answer then? I'm going to stop sharing my screen here. And Erica, I saw like a whole host of things here. Did you see any themes in the questions? Anything that that I could maybe start out with in particular?
I know there's some questions in regards to providers. So I don't know if you want to speak to, how providers will be able to work with Lyra and get more information there, and how employees will be able to find in-network providers.
Absolutely. Yes, I'd be happy to. So Lyra's network of providers is largely built of providers that contract into our network, just as they would for a traditional health plan and just as they do for Quest Behavioral Health today. So they'll become a participant of our network, and you'll be able to continue care with them just as you do today. We are built up of community providers. You also may have seen that Lyra does employ a portion of our provider network. Those are individuals that work for us full time, but ultimately is about less than 10 to 15% of our network. The bulk is made up of community providers local to the area who will work with you just as they do today. The way that you're going to be able to access those folks are one, of course, you can pick up the phone and call our care navigation team so that you're able to find a provider. You can go onto our website and you'll go through an assessment, answer a couple questions. It is completely optional. You can decide not to answer those questions and just seek providers, and you're going to be surfaced providers that have that guaranteed availability within the next 2 weeks. You'll also be able to leverage those things like preferences that I talked a little bit about before. The other important thing to note is if you're already working with a provider and they join the Lyra network, you're not going to need to go through all of those processes. You're just going to be able to continue care with that provider since you've already been connected with them, and they're simply going to start submitting their claims to Lyra Carillon so long as they have actually become in network with us.
And there's a question that kind of ties to that about options for individuals that cannot get a needed match. They mentioned like a young child at ASD needing local in-person play therapy. I know we'll still have out-of-network benefits, but I don't know if there's more you'd want to add to that.
Yeah, absolutely. So a few things on that subject. Of course, that's where the power of our 24/7, 365 care navigation team comes back into play. They'll be able to navigate your benefits to help you find the providers to be able to support you or your child in that instance. I will, of course, note that each situation is unique, and I do recommend starting next Monday, calling our team and asking your specific questions about what things will look like after July 1st. I will also mention that, we're really committed to continuity of care. If your child's already currently in treatment with a provider and that is going well, it's going to be detrimental for any kind of change there. That's where we want to be able to work to get that provider in network and then also explore other solutions if that for some reason isn't possible.
Okay. And then there's a question on if there are provider types that Lyra does not contract with. And I know that LSW comes in. We currently contract LSWs. Now you mentioned earlier our plan design isn't changing. So, intent is to keep all provider types that are covered currently to be covered as well. I don't know that there's more to say on that,
Yes.
but
No, yeah,
I'll let you take that.
yeah, no, that's absolutely the plan. The plan design is not changing overall. So what that means is if LSWs are covered today under Penn's plan, which they are, then they would continue to be covered going forward as well.
And then there's some questions that seem more provider related with like mechanics on how they'd submit claims and how they would be
Mm,
paid. And I think you may have said this, that providers will have access to engage with Lyra, and it might be best, I think, for the providers probably to speak directly with Lyra and Caroline on those specifics, but anything for the good of the group. Like, I don't
ab-
know technically how providers submit things, but I know that Lyra and Caroline could speak to the providers on that.
Absolutely. So a few things that I'll answer on that front. The first is, as I mentioned, that we will be contacting all Quest providers to invite them to join our network if they are not already. And part of that information is going to include all of those mechanics as to how they would submit claims to us, what working with Lyra would look like for them, so that they can feel fully comfortable in the practice, just as they would in joining any other network. So that's an important part that we're going to be reaching out to those folks. But additionally, for the benefit of this group, just wanted to share we're hosting a series of sessions just like this one, but that is tailored for providers in the community. Those providers who are currently in network with Quest Behavioral Health. We're hosting Q&A sessions like this. We have one scheduled for actually today, and then one upcoming Monday, and a few others in the future. And we're really working to make sure that we can answer all of the questions that folks may have about what it would actually be like to work with Lyra.
Right, and a couple of things that come to some information, I guess, that employees are finding on like the general Lyra site. One references therapists that are expected to use specific therapeutic modalities. Um, knowing that they're not appropriate for all patients, how employees have their choice in care. Um, I, I'll
Yeah,
let you take it from there.
I'm happy to speak to that. So high quality care is a really important hallmark of the care that Lyra Carillon provides to our patients. And so unlike a traditional network, one step that we take is we do actually meet with every provider for a brief interview when they join our network. And the purpose of that is to understand what their specialties are, to talk to them and hear about the types of patients that they work with, the types of patients that they're most successful in supporting, so that when we are matching patients with providers, we know that it's already going to be a really strong match. We know how difficult it can be if you need to bounce around to a few different providers before you find one that you like. So we're really working to try and make those matches as effective as possible overall. We do also ask providers the types of therapies they practice to ensure that what they're doing is industry standard, high quality, and evidence based. So we really focus on making sure that the practices that are out there are those that are proven to help individuals actually improve and get better.
All right. And I know there's
I,
some questions. Oh, sorry.
I was just going to say one
Oh,
other theme that I've seen in here are, somebody asked about if copays are staying the same. Yes, that's the same. The plan benefit design is not changing there. And then additionally, I've seen a couple items in here regarding AI and artificial intelligence being used in mental health care and how that is working. So a few things that I want to mention there. When we are matching patients with providers, we are leveraging the experience that we have of helping create these really strong matches with providers that have successfully treated other patients. So we use technology in the background to be able to match patients with providers that are best suited for them. This is not artificial intelligence. It is what is a kind of an industry term of machine learning, but it is not collecting data on people. It is making connections between folks. There's also been some questions about providers using AI or care through AI and what that looks like. What that looks like is it doesn't look like anything with Lyra today. We have tools that providers can use to help them in terms of note taking or making sure that they can be fully present in a session with the provider. Anytime that a provider is meeting with a patient, through video or anything along those lines, if they want to use those tools or record a session or anything, all of that must be done with informed consent. So no tools are used without a patient's full consent. And additionally, no providers joining Lyra's network are required to record sessions, to use any AI tools or anything along those lines. That is not a requirement of the network.
and there was a question too, just on data we received, just kind of, I feel like that kind of ties to the AI thing. That data being shared like with us as the employer, I think it referenced aggregate data. And so I feel like just want employees to know there's no personal data shared with UPHS or anyone in the benefits department. We don't receive any information on specific reasons for someone using a doctor or anything personal. That's all protected information. So if there's
Yes,
anyone out there. Uh,
exactly. None of that information is ever shared back with Penn Medicine. We legally could not even if we wanted to.
Um,
And
and mhm.
oh no, go ahead.
And I was going to switch. So if you want, I didn't mean to cut you off.
No, please go ahead.
Um, and data is not, someone said data is anonymous, but still shared. Like there's no personal information shared. Um, so again, so I'm not sure what the question is on the data, but there's a question too on like IBX and coverage there. So IBX is our medical carrier. They do not process behavioral health claims today and won't after July 1. They're just the medical side of things. today, Quest Behavioral Health, the behavioral health carrier processing claims. Lyra partnering with Carelon will process claims after July 1. So IBX won't be able to process claims for behavioral health provider even after July 1. They're just on the medical side. And there's a question too on like using providers. So if they're, worst case scenario, if there's a provider that doesn't partner with Lyra or Carelon, you have the option of still seeing them out of network after October 29th, that we have an out of network benefit. Hopefully though, with the additional education over these next several months, I know there's some misinformation providers you might be working with. Hopefully they'll have all questions answered and we'll partner up. But, worst case, there is an out of network benefit, but it would not go through IBX. So I hope that clarifies some of the questions I saw in the chat. Um, were there other themes you wanted to try to hit, James, that, again, with the plan design, again, it's the same. So how care is administered today is, tends to keep it the same. Tomorrow, as James shared.
Just looking here as well. There's some questions about our providers and quotas that providers have, concerns about their ability to practice care in the way that they would like to, so on and so forth there. So I'm really proud to share that the Lyra network turnover rate is less than 3 or 4% per year, and a portion of that is includes involuntary folks leaving the network because they may have violated a practice or something along those lines. Um, the reasons that providers typically like to work with Lyra is compared to traditional networks, we are able to reimburse quickly and do so at fair market rates. In addition, in working with Lyra, a community provider who's maybe private practice or independent gets the benefit of the support of a peer network through Lyra, being able to connect with other providers that are part of our network. If they need to, they're able to tap into support from our clinical quality team as well, if they need a case consult or other levels of support. And they're also able to provide, because they have the support of our care navigation team, in the event that a patient has a need that goes beyond outpatient therapy, they're able to get that really fast, warm handoff to care that's going to support them going forward. Our provider network does not carry those types of quotas or anything along those lines. They are as I mentioned, they tend to be quite happy and stick within our network.
All right, and I think you said this earlier, but providers do not have to become employees of Lyra to become in network with Lyra. I think you said that in the beginning. I know there's like a 1099 question, like they are not forced to become, like a quote 1099 employee. They can be their own person and still join the network. Am I incorrect in saying that?
Yeah, you are correct in saying
Okay.
that. They do not need to. It is just as if an individual is joining um, a traditional mental health network. They are in network. They are not employees. And I see the question here about, so why the provider interview to join Lyra? Going back to what I said a little bit earlier, the reason that we do that is we're looking to understand the individual and their experience in care, going beyond what you see on a CV or a resume, so that we can know the types of patients that they're most comfortable with. We also have each provider create a personalized profile on our page so that individuals who are searching for care can find someone that really resonates with them and talks about some of the things that are important to them. There's that, and then also making sure that they're practicing evidence-based therapies, that they are practicing high quality care, because we want our members to be able to work with the top quality care in the area.
All right. And with the questions, so, after today, I'll go through the chat to make sure all the questions are answered. we'll, as James mentioned, we'll hold more sessions as well over these next few months. And with timing, this is the typical timing for open enrollment. Our new benefit plan year starts July 1st. So it's this typical time frame where we're in April, send out materials to our employees to let them know what the changes are. Open enrollment starts April 27th. It's actually 3 weeks this year, which is a week longer than normal. So you have that 3 week time frame to continue to review information to figure out what choices you want to make for that new plan year that starts July 1. Again, we'll hold more sessions. This is a wonderfully attended session. So this will be recorded, but we will hold more as well. So anyone who couldn't attend today, if they want to ask more questions, can have that opportunity. Lyra will also be at the on-site benefit fairs.
Mhm.
So if you haven't attended one, there are still a few more that we're doing over these next few weeks. So if you can attend a fair and you can meet with someone in person at Lyra, I know we have a couple fairs coming up in Lancaster. We'll be at Princeton next week. Um, so on the online in the PM report, if anyone receives that, there is an open enrollment link. So it's an email you get every day, the Penn Medicine report. And I think Laura just posted that in the chat. So that link will take you to where all the on-site dates are. That's probably where you went to register for the session, is my guess. So please come to an on-site fair if you haven't had the chance to. But like I said, we'll go through the chat, make sure we answered everything. I think we at least talk through all of the topics that came through, but we'll make sure if there's one we missed. They were kind of coming in a few times. So we'll make sure we try and get to everyone there. Um, so I appreciate everyone joining the session today. Thank you for taking the time to learn out more. And keep an eye out for, again, for more information that we'll send out. So, thank you. I hope everyone has a
Thank you,
wonderful
Rowan.
day.
I appreciate your time.
Thanks, James.